So what are the oral medications that are often suggested to patients struggling with interstitial cystitis or bladder pain syndrome? Well, the first medication that's usually mentioned is amitriptyline. Amitriptyline is a low-dose antidepressant. Now, you should never be offended if a doctor suggests it to you. It's not like they believe that this is all in your head. Amitriptyline is actually quite good at calming nerves down and is a mainstay in the treatment of a wide variety of pain conditions. Our challenge is it also comes with a significant burden of side effects. Dry mouth, dry eyes, weight gain, and cardiac abnormalities. In fact, that's what happened to me. It gave me a very rapid and irregular heart rate. So if you're somebody who gets a rapid heart rate tachycardia with Benadryl, the odds are this type of medication might not be right for you, and you're going to have a really good conversation with your doctor about it. But perhaps our biggest burden with amitriptyline is that it is an anticholinergic medication. Anticholinergics have now been linked to cognitive decline if used consistently every day over time. And not just in seniors, but also in younger patients. And so we're kind of stepping away from the long-term use of amitriptyline to try to make sure that your cognition stays intact. Now, the next medication that often comes up is hydroxyzine, also known as Atarax or Vistaril. It is an antihistamine. The nice thing about this medication is it also has a very nice beneficial side effect as being a bit of an anti-anxiety agent. So hydroxyzine has been found to be helpful in patients who have allergies or patients who flare during allergy season. There are other medications that are typically prescribed for overactive bladder, like oxybutynin. These are smooth muscle antispasmodics for patients who struggle with spasms at the end of urination. So they too were once quite popular, but they too are anticholinergic medications that come with that risk of cognitive decline. So there has been a dramatic shift towards a new medication called mirabegron, which can dramatically improve frequency urgency, but is not an anticholinergic medication. So you want to have a discussion with your doctor about that if you're struggling with extreme frequency urgency. It might be helpful. It can, unfortunately, also be a bit on the expensive side. Another class of medications often suggested is cimetidine, also known as Tagamet, which is an acid reducer, just like Preleaf, the over-the-counter supplement, is an acid reducer. Now, the only medication approved by the US FDA for IC is called Elmiron, also known as pentosan polysulfate. Elmiron acts to coat the bladder. It's kind of like a chemical Band-Aid in the bladder, and was quite popular for many, many years, but unfortunately in recent years has been associated with two significant adverse events. The first one is retinal disease, known as pigmentary maculopathy, and we have some patients now whose eyesight has been dramatically affected. The second adverse event, which is newer, is inflammatory bowel disease, and there are some patients who have had to have colectomies, portions of their bowels removed. The last medication that is often suggested for patients who are very, very severe, patients with severe Hunner's lesions, patients who are not responding to other therapies, is called cyclosporin. It is an immunosuppressant medication. But it's a bit of a scary drug. It has some pretty significant side effects, particularly high blood pressure. So while a urologist might suggest it, they will usually send you to another doctor who will monitor you carefully while you're using it to make sure that you're not suffering from any of the more severe side effects. Cyclosporin is not for the faint of heart. It requires a lot of consideration about potential side effects, pros and cons. But anyway, you can learn a lot more about cyclosporin and the research which has supported cyclosporin use, as well as the research which has supported all of these other therapies, right over on the IC Network website, icnetwork.org. Take-home summary. 6 types of oral medication can be suggested to reduce the urinary symptoms of IC, including antidepressants to calm sensitive nerves, antihistamines to help allergy-driven symptoms, antispasmodics to calm bladder spasms, acid-reducing meds, bladder coatings to help protect the bladder wall, and immunosuppressants. Now, some of these meds may be difficult or impossible to tolerate. Some meds come with the risk of severe side effects, and your phenotype can determine which medication is best for your unique case. So here's some questions you can ask your doctor. What is this treatment meant to do, and how does it work? Will this treatment treat the underlying cause of my pain, or is it just to manage my symptoms? Is this treatment suggested for my phenotype, such as Hunter's or pelvic floor? Is this treatment associated with side effects or adverse events? What should I do if I have a severe side effect, such as a rapid heart rate? If a treatment does not work, should it be continued? How long is this treatment meant to be used? 6 weeks? 6 months? Is it safe, or are there risks for long-term use? If my treatments are not working, have we found the correct diagnosis? Could something outside of my bladder be causing my bladder symptoms, such as pelvic floor dysfunction and pelvic congestion syndrome? If you're looking for more information, come on over to the IC Network website, icnetwork.org. We welcome you.